My daughter is 15 years old. She used to have pink gums, but over the past year, that has changed. How can we help restore her gums back to a healthy pink color?
Um, well, first thing is like just because the gums do not look pink, that doesn't mean like you need to have a treatment done. Unless you have unhealthy gums, like meaning it looks red, puffy, swollen, bad breath, bleeding, and that is the case. Yes, you need to have some treatment done. But when you grow, sometimes depending on the ethnicity of the people, sometimes the gums have a tendency to change color. It could be due to some kind of like a melanin pigmentation. If that is the case, it is absolutely normal. You don't need to worry about it. However, if it is because of the tartar, right, like I said, like whenever you have disease, if it is due to plaque or the tartar buildup, which is going to happen under the gum line, if that happens, then you need gum disease treatment. If it is due to like some kind of a hormonal changes, and if it is a regular hormone change, great. If not, then get it checked out with your doctor. Then and yet of course the dentist also, whether there is any kind of a hormonal treatment that needs to be done. And people smoke and people vape, and that is one of the reasons why the gum tissue change, because you're literally kind of like heating the gum up, and then you are kind of boiling the gum up, and then that kind of changes colors, and it the gum tissue becomes really pale white because you you compromise the blood supply. If that happens, then again, cutting down on smoking and vaping, it is going to help, but again, check it with your dentist. Sometimes it could be due to medication. Do you remember the patient that we had again in Cedar Hill yesterday? The last patient, we are going to try and do the laser treatment, and for financial situation, we decided to do the gum treatment. Yeah, the deep cleaning. So that patient was on 4 different blood pressure medication. So when you are taking multiple medication, particularly the blood pressure medications or sometimes the seizure medication, they have a tendency to overgrow the gum tissue. We call it as a gingival hyperplasia or overgrowth of the gum. So it could happen because of the medication. Sometimes when you have this overgrowth because of the loss of blood supply, sometimes those kind of appear to be like kind of white also. Again, the simple answer is go see a dentist, get it checked out, find out the real reason, whether it is normal for you to have this, or it could be something critical that you need to get it checked out. With your daughter being like about 15 years old, should you be worrying about multiple things that I mentioned? Probably not, but I don't know your daughter's condition. She could be taking seizure medication, that probably could have happened. So get it checked out with your dentist.